Good afternoon, everyone, and thank you all for joining us here today. I'd like to welcome all of our speakers and give everyone a quick reminder of what our run of show is. We will be starting with Mayor Jenny Durkan giving remarks to welcome all of us, followed by UW President Anna Marie Kause, followed by Seattle King County Public Health Director Patty Hayes, followed by Fire Chief Harold Scoggins, and finally Dr. Jeff Baird from UW Medicine. We will follow our presentation with a Q&A, and I thank you to everyone who has already RSVP'd. We'll be sure to get through as many questions as we can today. And with that, I'd like to turn it over to Mayor Durkan.
Thank you, Anthony, and thank you all for being here again today as we announce a wonderful new partnership with the University of Washington, UW Medicine to provide free citywide testing. We must remember we are still in the middle of a pandemic. And as you know, our region was one of the first to experience and was the epicenter in our nation for dealing with the COVID-19 public health emergency. The eyes of the whole country were upon us as we were forced to become a leading face of the crisis, and because of the lack of leadership at the federal level. I really want to thank Patty Hayes, who is on this call, and King County Public Health for all the work they've been doing over the last 3 months. I know they have been working tirelessly on every front to keep us all safer. We all together saw the early devastating impacts of the virus as it moved quickly and quietly through our community because it looked like the common cold or the seasonal flu. And the city and the nation have suffered so many needless deaths because the virus was able to spread quietly without people seeing it because of the botched testing at the federal level. And I would say to this day, cities do not have the equipment they need to adequately test residents. And we've been forced in a situation where it's city versus city, state versus state, in almost a Hunger Games mentality, trying to secure tests in almost any way possible. The city of Seattle has always been an innovative leader, and we've continued to lead through this crisis. But we haven't done it alone. We've done it with great partnerships, including the UW and Seattle King County Public Health. Chief Scoggins will address you shortly and will tell you about some of the remarkable work that Seattle Fire Department has been doing throughout this pandemic. They stood up the first test site for first responders, using first responders to do the testing, and they helped others in the jurisdiction have that capability. The pilot was so successful that it was expanded to city employees, healthcare workers, and staff from the city emergency shelters. We're also nationally recognized for our mobile testing within long-term care facilities for our mobile assessment teams. Again, a great partnership with Public Health Seattle King County. I'm really thankful today that we will be launching this partnership with the University of Washington Medicine, furthering our reach into Seattle's communities to provide for a safer, healthier, happier Seattle. President Kause and I will be signing a memorandum of understanding after everyone speaks to formalize this new partnership. And I just really have to commend President Anna Marie Kause because she has worked tirelessly on so many issues from the beginning of this pandemic, having to navigate what do you do as a college and an employer, where you have students who are residents that may not have access to other housing or be able to get home. And she did it also working with one of the premier medical facilities in the country, not just for treating people, but because of the scientists who are there, who really helped us understand the extent and spread of this disease. By working together, we will increase testing by up to 1,600 tests per day in the city of Seattle. Starting today, we're asking residents to register prior to testing by visiting a new website, and that's at seattle.gov/COVID-19. Clients will not be charged for the testing and will not receive a bill. Beginning tomorrow, 2 drive-up testing sites will open at 2 former emissions facilities that we have leased in the north end off Aurora and in the south end in Soto. Testing will be available Monday through Saturday from 10 a.m. to 3 p.m. We all know by now that without a vaccine, or really effective treatment, the most important thing we can do is to practice excellent hygiene. The next important thing we can do is to get tested. Testing is a key to providing a return to a sense of normalcy. We know that it won't be the same as before, but together we can work to make this better. Again, I really want to emphasize people still need to practice good hygiene. Keep a distance, 6 feet or more. Use a face covering when out in public and you can't social distance. Wash your hands frequently or use hand sanitizer. Before I turn it over to President Couche, I want to thank all of the people at Public Health and the fire department for all the work they've been doing throughout Seattle and throughout King County to keep us all safe. I particularly also want to thank the U.S. Digital Response Team, who worked so quickly to stand up a registration platform to allow residents to register online at no cost to the city. For those people without access directly to computer online, we're working to make sure that sign up is available for everyone. And with that, I'll turn it over to the University of Washington President, Anna-Marie Couche.
Thank you very much, Durkan. I want to echo your sentiments about how important this testing is to the Seattle community. I also want to thank you for your leadership dealing with this very, very difficult pandemic. The University of Washington is not only a public state university, we're an integral part of the Seattle community. An important part of our mission, then, is to help care for the citizens of Seattle, including our most vulnerable. UW-Medicine has been at the forefront of the pandemic, not only providing medical treatment, but developing one of the very first COVID-19 tests in the country. This partnership is a great example of how we can amplify our impact through cooperation and collaboration. The city will provide the sites, infrastructure, and materials necessary to administer testing. Seattle Fire Department's first responders will perform the vital testing, and UW-Medicine's virology lab will process the tests and get information back to our citizens quickly. Together, we're poised to provide the necessary testing to help keep our community healthy and safe. This testing partnership is the right thing to do. We're so proud to be part of this effort and so proud to be part of this great community. Thank you.
Thank you, Dr. Thank you, Anna-Marie Couche. We are now handing it over to Patty Hayes.
Thank you so much. This is so exciting to be here and participate in the launch of this partnership. I want to express my deep gratitude to the mayor and the president for the leadership moving forward, and to Chief Scoggins and Dr. Baird for just developing this partnership so quickly. You know, testing, as the mayor has said, has changed over the early days of the pandemic. In the very beginning, we were so short of tests that we were limiting who could go get a test. And now we're urging everyone who has symptoms to get tested, not just high-risk groups. And I want to emphasize that because we need to get that message out to everyone. Testing is important for young and old. We are seeing illnesses in all age groups. And the preventing of COVID-19 from spreading to family, friends, and the community by getting tested as soon as you can is just an essential strategy that we're really excited to launch with this partnership. You know, testing is one way of getting back to everyday activities. It's a key metric. It's one way we can prevent the virus from spreading. You can say that we are looking to get the most identification of those who are COVID positive so that you can quickly take action and not expose to your loved ones and others of your neighbors and friends. It's also important that we really do get tested quickly. That's going to be a new normal for us because many of us don't always call our healthcare provider every time when we have a new cough or we have symptoms. But with COVID-19, because we don't have a vaccine and because we don't have a lot of treatment, the treatment options are going to emerge. But right now, it's just a lot of hard work at the University of Washington and other places. We need to get to testing as soon as we can. So if you develop a new cough, you have difficulty breathing or other symptoms like a fever, shortness of breath, chills, muscle pain, something unusual like new loss of taste or smell, sore throat, vomiting or diarrhea, we want to test you. So when we look at who is being tested positive right now, as the pandemic continues to go through our community, we know that right now we're going to begin seeing more activity and more workplace activity. So it's really important and very exciting that at this time, this partnership is being launched. Testing is also an essential strategy for our partnership with the State Department of Health on contact tracing. What is that? That's when we learn that there is a new COVID case, and we begin working with that individual to make sure they're safe and they are isolated during the right time while they're ill, but also contact the folks that they've been in contact with so that we can get testing, which is the link to this new program, and as well as to get them quarantined so that they are safe. So again, it's so exciting to expand countywide testing. We have more supplies. We have more opportunities to work with great partners like UW Medicine. We have the great partnership with Seattle Fire that's been just really incredible, and my deep gratitude to the chief for all the work we've done. So I'm excited to get this launched tomorrow and really excited to see the positive benefits for our community. Thank you.
Thank you, Director Patty Hayes. Moving on to Chief Scoggins.
Hello, my name is Harold Scoggins, Fire Chief of the Seattle Fire Department. You know, this is another really exciting moment in a very difficult time. I can remember 8 to 10 weeks ago as we walked into the pandemic and we were trying to figure out a way here in the Seattle Fire Department to get our firefighters tested so we can get them back on the front lines or we can put them in isolation and quarantine. And it was a group of our firefighters who came up with the idea and said, hey, why don't we train our people to do the testing? And I'm amazed of what that's blossomed into. You know, 8 weeks later, we've tested here at our Seattle site 565 first responders from all over the state that have come to get tested at our site. We have since stood up 2 additional first responder testing sites, one in Shoreline and one in Covington. So altogether, we've tested over 750 first responders. And that's really serving not just Seattle or King County, but our entire region in helping out. And then we move forward with another role of testing. We saw there was a need in our long-term care facilities, places where we go on a daily basis and we see the vulnerable populations in need. And then we went into that space. To date, we've done tests in 24 long-term care facilities and tested over 1,300 residents and staff. You know, that's really exciting. But that's who we are as Seattle firefighters. You know, as we've been moving forward with the protests over the last weeks, we've done everything from board up businesses to program radios for the National Guard that's here. So this is another place that we feel like we can help. Right now, I'm excited to introduce Lieutenant Brian Wallace, who actually had the idea with our team of how we do this and how we keep expanding it. He's going to talk about who should get tested, what to expect, and how do you obtain those results. Lieutenant Wallace.
Thank you, Chief Scoggins. As Director Hayes iterated, it's crucial that people get tested immediately at their onset of symptoms. We want to see people with even the most mild of symptoms come to the clinic and get a test as soon as possible. We also want to see anyone that's been exposed to a COVID positive patient for longer than 15 minutes come in for a test as soon as they can. What you should expect at the clinic, once you've fully registered and completed all of your paperwork online, is a process that should only take about 10 minutes from the time you arrive to the time you leave. We have clear signage and cones to direct you where to go. Our personnel will be wearing full PPE, and a registration tech will make sure you're in the system. and then an EMT swabber will place a swab deep into each of your nostrils. It's not comfortable, but that procedure only lasts for about 30 seconds. You'll be able to get your results as early as the next day with a QR code that we give you at the site. You can either scan this on your smartphone or you can look it up on a computer. Those results usually are available the next day, but they may take up to 24 to 48 hours. Thank you, Chief.
Thank you, Lieutenant Wallace. And that's a lot of hard work that he just talked about in just under a minute. And he is really the source of where all this has come from. Our goals with the site is to remove barriers for testing. Like the mayor mentioned, we want everyone to come in and get tested at our sites, and they're free of charge. We wanted to make it easy to register, and we wanted to make it a quick process. We have 2 sites that are being stood up and are going to be opening up. One of the sites is in North Seattle, the Aurora Emission Center at 12040 Aurora Avenue North. That's 12040 Aurora Avenue North. And the second site is in South Seattle in Soto at 3820 6th Avenue South. That's 3820 6th Avenue South. The sites will be open, as the mayor mentioned, Monday through Saturday from 10 a.m. to 3 p.m. One thing that we do ask is that you register ahead of time. Please, please, please register ahead of time at seattle.gov/COVID-19 testing. You'll receive all the instructions and information that you need right there. But I do want to let everyone know we will not turn anyone away. Our goal is to really help as much as we can in this pandemic. As the mayor mentioned, when we get up to full capacity, our goal is to test 1,600 a day between these 2 sites. So I want to thank our mayor for her steady leadership in this time. I want to thank President Cauce, University of Washington, and our public health director, Patty Hayes. Our partnerships have been incredible. Our teams have been working together over the last 90 days. And once again, I want to close by emphasizing, anyone with mild symptoms, we want you to come in and get tested, or anyone who has been exposed to someone that's positive with COVID-19, we want you to come in and get tested. Thank you.
Thank you, Chief Scoggins. Dr. Jeffrey Baird.
Thank you very much for having me, and also thank to the folks who've spoken before me. Thank you, Chief Scoggins, Director Hayes, President Cauce, and Mayor Durkan. Thank you very much for allowing us to contribute. My name is Jeffrey Baird. I am the interim chair of the Department of Laboratory Medicine at UW Medicine. I said I'm very happy to be part of this. At the risk of repeating what's been said, while social distancing, masking, et cetera, are very important parts of what we can do as a community to fight this disease. Obviously, testing is very, very important, and testing is what I do for a living, so I care about it an awful lot. I'm very proud that our UW Medicine Virology Lab was among the very first laboratories in the country to develop and scale a COVID-19 test, which we were then able to use to help our first responders and our patients and our healthcare workers. We can do many thousands of tests a day above and beyond what we actually do right now. So we have the capacity to do this and are really very happy to be able to support the city of Seattle in this effort. We also, in our UW Medicine, had one of the very first COVID-19 drive-through testing sites too. With our current workflows that we have invested heavily in, we offer turnaround times that are generally substantially less than 24 hours from the time that we receive it, but definitely essentially always at 24 hours from the time that we receive it. And as the chief also mentioned, very early, and I remember this quite clearly, we developed that QR code, technology to retrieve results as essentially sort of a stat IT effort right in the middle of all the craziness. And so we're so proud that that's been used so often by so many people in this community to get their test results. We really do believe that testing is the way that we're going to get out of this until we end up having a vaccine. To reiterate also, there is no cost to those who are going to get tested. We will handle the insurance part of that so that there would be no out-of-pocket expenses to the to the folks who end up getting tested. And I really just want to reiterate that this partnership is a win-win for everyone, and I really do think it makes our city a lot safer. And so with that, I'll thank you.
Thank you, Dr. Baird. At this time, Mayor Durkan and President Cauce will sign the MOU. We'll ask them both to do that on their opposite ends of our virtual table here. And I would ask that when you are both finished signing that, to please just hold it up. Let everyone take a look. That's great. Thank you, Mayor. Thank you, President Cauce. At this time, we will now move to question and answer. As a reminder to everyone who is joining us today, I will control the audio for our question askers. For our panelists, if you would like to jump in and respond to a question, please feel free to do so. The video feed will automatically switch so that you can be seen. Our first question will come from Hannah Scott, Cairo Radio. Hannah, the floor is yours.
Wants to answer. I'm curious, we heard also from the governor today about the need to really have everyone with mild symptoms get tested, as well as anybody who's thinks they've been exposed. What would be your message to people out there, especially given the large number of people we're seeing taking part in protests, to make sure that they get tested? And why is it so important as we start to reopen to have that testing done?
So this is Patty Hayes. I'll start with this. I'm delighted that the governor has joined the voice to really emphasize testing. And we have to really encourage our whole system, including our healthcare providers, to respond to this. So people need to be asking for testing now when they have mild symptoms or they've been exposed. For the folks that have been exercising their rights in protest, I'll say again, the number one thing for folks is to do the best they can to maintain social distance, to wear a mask, to really be mindful not to go out if they're ill themselves. Those are key things for the protesters. We're in conversations with CDC on the best recommendations for folks who are out and protesting and exercising their rights. And we want to make sure everyone is safe. So we do want to continue to emphasize the social distancing, the physical distancing, actually, and the other measures that people can take to keep themselves safe. And then testing comes in as the key strategy for us to begin to get ahead of this with our case and contact tracing. So I appreciate that question.
Yeah, I'd just like to add, as someone that works with young people all the time, many of whom have been, experiencing a lot of anguish and have been protesting, and that is absolutely their right, that sometimes, they get the impression that because very few young people are dying from this, that it's not something that they need to worry about. And my message would just be, it's important that you get tested, because even if you are unlikely to get ill, you could be a silent carrier, you could be an asymptomatic carrier. And when you come home to your parents, your grandparents, or other people your own age that may have autoimmune conditions, et cetera, they may end up being very vulnerable. So if you are experiencing even mild symptoms, please get tested. It's like masks. You don't wear it for you, you wear them for others.
Thank you very much, Patty Hayes, Director Hayes, and President Cauce. Our next question will be from Kevin Schofield, SCC Insight. Kevin, the floor is yours.
Thank you. So one of the issues that a number of institutions have reported who've been trying to organize ongoing testing has been not having enough or reliable supply of testing materials, such as swabs and the fluid that the collection swabs are put in afterwards. Do you feel like you've obtained a reliable, sustainable supply of materials so that you can sustain this over the long term?
Chief Scoggins or Patty, do you want to take the first crack at that?
Sure, I'll start and then the chief can speak up. We, in this marvelous relationship with the University of Washington, as well as the state working very hard to open up more avenues for testing, are at a place, and this is one of just the first couple of weeks where we have felt like we actually have sufficient test kits to supply all the different venues where we're doing this. So opening this up right now is the perfect time. I just want to give a shout out again to the University of Washington. They have been an amazing partner in this for getting test kits. And I have to, again, just shout out to the mayor. She has been absolutely dogged about making sure we can turn everything upside down trying to find test kits. So things are really stabilizing better in this way. We're always watchful, but right now I feel confident.
And I would say on the part of the University of Washington and UW Medicine, we've sourced multiple swabs from a lot of different sources. I have worked with individuals in the city to find, as Patty just said, to dug pretty deep, looking all around the world for supplies, and we have we're in a much better place in that regard right now than we were in March or April.
And right now, our testing supply cache, if we tested 1,600 people a day, we can last 45 days with our supplies that we have in stock right now. So I believe we're ready to go.
And I would add one more thing that I want to make sure folks watching know that we're also expanding testing around the county as well. This is a very special partnership and is allowing us to really get into the city of Seattle. We're proud of that. It's creating a model for us for King County. So again, grateful for that.
Yeah, and I really want to echo the great partnership with Patty, with Chief Scoggins, with the UW. We truly have been looking everywhere to source test kits, including in foreign countries, and trying to get a stabilized service. It will be one of the, for a large city, doing our own testing will be significant, but it wouldn't happen without these partnerships. UW has led the way. I think everyone in the nation has looked to Public Health Seattle King County for leadership because they were the ones, that were the epicenter at the beginning. I also want to emphasize two other things is these are our first two sites. We're looking to see whether we can establish additional sites even during some days, particularly to be accessible to South Park or West Seattle, because we know it's difficult for people to get from that part of the city, and we don't want there to be any barriers to testing. We also will be setting up mobile testing capability for people who are demonstrating. We've had a number of conversations in the last 4 days with public health, with Patty and with Jeff Duchin, Dr. Jeff Duchin, about all the range of things we can do to make sure that protesters are able to get adequate testing. So we're looking at a range of ways to do that. I want to also emphasize again, I agree so much with Patty in that, as much as people can to do the other things to prevent this, which is good hygiene, social distancing, face coverings. But we've all seen the demonstrations. We know how close people are together. We know that there's some scientific evidence that shows that when you're in close proximity, particularly if you're shouting or yelling, you could be exposing more people. And that's why it's going to be so critical, either at the first sign of symptoms or if anyone has tested positive, to get tested so you can get isolated and not spread and transmit the virus more. So I want to thank Dr. Duchin and Patty Hayes for their leadership in trying to work on across all levels in our senior facilities, now with people who are demonstrating, and making sure we make this as accessible and free as possible.
Thank you, Mayor Durkan. Thank you, everyone, for answering that question. We have one final question right now. It will come from David Hyde at KUOW. David, floor is yours.
Hey, sorry about that. I didn't realize you were going to go to me. Yeah, I did have a question. Just could you put the 1,600 in context, Patty, so I understood how that fit into the larger testing picture in King County and even Washington State?
So our goal to increase testing is to get up to doing 5,000 or more tests per day. Right now, we've been averaging around 2,000. So this addition from the city is an amazing bump to what we know we need to be doing. That's part of the metric for what the governor has set for the target metrics on what we need to be doing for reopening and allowing more activities and more of our businesses to function. So this is all part of that scaling up and getting the message out to both providers to really respond when somebody calls and says, I have some light symptoms, can I get tested? Yes. And also to encourage people wherever they're at, to go in if they've either been exposed or have mild symptoms. Thank you.
This is Jeff. I would just add also that the capacity that we have at UW Medicine to do testing, we do currently do on the order of 2,000 to 2,500 tests a day during the week. And we can do approximately 3 times that many with the analytical capacity we have, meaning the instrumentation. But it's a project like this and a partnership like this that actualizes that capacity, because it's more theoretical capacity until we have a partnership with the city and we have sites where these can be collected, and we have the Seattle Fire individuals who can help us collect those and all that. So until a swab goes in a nose and gets sent back to us, there's no capacity. We're not doing that testing. But when we have projects like this that can actually facilitate the start to finish of the entire testing cycle, that's what actually ends up allowing us to get at as many people as we can.
Thank you, Dr. Baird, and thank you, Director Hayes. I want to acknowledge that this is the end of our Q&A session for this press conference. If you did not get a chance to ask a question, please follow up with me and we'll be sure to forward those questions along and make sure that those get addressed. At this point, I'd like to turn it back over to Mayor Durkan for closing remarks.
Thank you. And again, I just want to thank the partners who are on this call. And we were unfortunate in that Seattle and King County were the original epicenter. So we were operating without any playbook or any guidance or any federal leadership. And so our ability to pave the way forward really depended that we were also the location of some of the leading scientists and health professionals in the country. And the Seattle flu study gave us some early guidance. People at the University of Washington and at the Fred Hutch gave us invaluable modeling. And now this partnership will actually give us the ability to do testing at a scale we need to do as we reopen society and reopen businesses so that we can keep control of this virus. It's still an incredibly dangerous virus. And I think that in many ways we've forgotten that because there's so much else that is occupying us as a city. But we have to remember that this pandemic is real. The virus is a real threat. And so if you have any symptoms at all, or if you know anybody who's tested positive, please get tested. It's free, it's relatively painless, and we do want you to get tested so we can stay healthy as a city. Thanks so much.